Welcome back to Health on the Line and our show on rare diseases. Behcet's disease causes inflammation of the blood vessels in your body. Now that sounds harmless enough, but the rare chronic disorder can be excruciating and very difficult to diagnose. Joining us now, two people with Behcet's, Tracy Graves and Cindy Foster. Thank you both so much for being here.
Thank you.
Can you give me a further explanation of just what Behcet's is?
Well, it is, as you say, it's an autoimmune disease. It affects basically every part of our body. We get mouth ulcers, genital ulcers. It affects our eyes. It affects our joints, our central nervous system. We get extreme fatigue, headaches. We get extremely bad headaches. It can put us in bed for days. What else? What it is basically is our immune system, what is supposed to help us fight infection, actually attacks our body.
And you both have some photos that you brought in, but we're just going to pop some photos up and you can explain to me where they're ulcers. It's almost like canker sores, right? Mm-hmm. Can you describe what we're seeing here?
That is actually one of the cankers of the many I had in my mouth that day. That is one of them, and that's one I had on my tongue.
And these are you're getting, there are huge amounts of them, right?
Yeah, yes, I have had hundreds at one point in my mouth, and they get to the point where I can no longer eat. And I've had them to the point where I've gotten down to 87 pounds because I can't eat.
Hmm. And you just had a flare-up, a pretty serious flare-up.
Yes. When I go through my flares, I have them a little bit differently. A major attack for me attacks my central nervous system. So I have similar to like a mini stroke. So my left eye starts to droop, my mouth starts to droop, and I lose sensation in my left side of my face. The right side of my body starts to lose sensation. So I have more symptoms of a mini stroke as far as I have problems with my speech.
And we can see the photo, you can see that your eye is drooping there.
Yeah, that's just the beginning stages, so it's not in full effect. This photo here is actually some of the types of skin lesions that we do get. So this is just one type of the many different types of skin lesions that go along with Behcet's.
And is it painful for you too?
Everything is painful. So it doesn't matter if it's the skin lesions, if it's the mouth ulcers, the genital ulcers, the joints, every aspect of the disease is painful. It's because it's inflammation, you got to remember that anytime you hurt yourself, you sprain your leg or anything of that, it's painful. And that's basically a form of inflammation. Well, ours goes through our blood vessels and inflames the actual blood vessels themselves, which causes extreme pain.
And yet it's not something that you're living with day in and day out, right? There are flare-ups?
Well, we live with it daily, but when the flare-ups happen, it just makes it worse. It magnifies it.
So is there any idea of what triggers a flare-up?
Stress is a big one. When I quit smoking, it exacerbated everything. It just made it way worse, which was the stress. The doctors told me the quitting smoking was the stress that my body went through, just made everything 10 times worse.
Do you have the same triggers?
Stress, yes, can be a major one, but I haven't, there's no particular rhyme or reason for mine. It can come out of the blue. I can be on vacation. I've had major flares while I've been on vacation. So that stress hasn't played a role in that factor. So I haven't really found a triggering point for me. Weather sometimes plays a role for me. That can be a trigger point. So everybody's got their own little ways of what triggers it for them.
And when you talk about this as being something that so few people have, your challenge too of getting a diagnosis was enormous, both of you separately, right?
Yes.
Can you talk to me a little bit about how long you went and what some of the roadblocks were in actually getting a diagnosis of Behcet's?
Well, I've always suffered from ulcers in my mouth since I was a child.
And you just thought they were cankers,
and
bad
I just
cankers.
thought they were normal cankers, but they started to get larger, and I started to get more than just one. I would get 5 or 6 in my mouth, and that's just not normal. And then I started to get pains in my legs, and the odd thing, just not normal for people to have, but I would have more. And going to the doctors, and the doctor would just think, come on, like, you're a hypochondriac, somebody doesn't have all these things wrong with you. And I just kept going to the doctors over and over again. Finally, I printed a whole bunch of diseases up on the internet. I said, pick one, send me to a specialist. I'm not leaving your office till you send me to somebody. She sent me to a specialist. I was in her office 5 minutes and I had a diagnosis.
And how long was that process, though?
Years. It took me, I would say 10 years before I got a diagnosis. But it took me that 10 years, and before, when I got that appointment to go see the specialist, I would have been dead if I had to wait any longer, because that's how ill I was.
What do you mean you would have been dead?
Because I was no longer eating.
Because it was so painful just to eat. And then people thinking that somehow this was in your head, right?
Oh yeah.
And that's very typical with this disease, especially being a woman going in, that doctors look at you as if it is all in your head, because it masks itself in so many different forms. Behcet's is similar to having having symptoms of MS, lupus, Crohn's, rheumatoid arthritis, all kind of massed into one disease. So you have all these different symptoms and they come and go at various times. So you're walking to the doctors all the time saying, this hurts or that hurts or something else is wrong. So they're looking at you and saying, no way, that's impossible. So you must be making it up. So then they're looking and saying, go see a psychiatrist.
And weren't you told to go see a psychiatrist? Oh, it was all in your head?
It's all in your head. You're making this happen.
And I did go down that path. I did say, well, if it's all in my head, then fine, fix it. Let's get on with life. I don't want, what's going on with me. I don't want this to happen anymore. And the psychiatrist basically said, whoever sent you here, take this letter back and tell them there's something definitely physical. It is not in your head. There is nothing wrong with you psychologically speaking, and go find out what's wrong. And that was after I'd been rushed out to the hospital twice. The first time they thought I had an aneurysm. Second time they told me I had had a stroke. And then they came back and said, well, we can't find anything clinically wrong with you as far as our scanning and everything. So it must be all in your head.
And it was really the internet that helped you figure out the diagnosis, right?
Not for me. The internet came for me after I had made the diagnosis. I was referred down to Sunnybrook, and a doctor down there, after I told him what had happened and that the ulcers in my mouth, that was the key to everything. They had gotten so bad I was spitting out blood and everything at that point in time. And he said, I think I know what's wrong. I've only seen this once before in my whole entire career. I think you have Behcet's. That was the first time I've ever even heard of the word. And that was where my journey started as, what is Behcet's? And then shortly after that we got a computer, and that's when I started doing my research.
And we'll talk a little bit about how the internet has helped so much, helped you guys get connected and get a chance to meet each other. But in terms of treatments, is there a way is there a treatment that you have? You were mentioning that today you're supposed to be going in for a treatment. What do they do?
I have, and Cindy also has it, pulse steroids through IV. I have been on prednisone for the past 3 years, but that has some terrible side effects, so now the doctor's trying pulse IV steroids, because it...
To reduce the inflammation?
Yeah, and if you get it through IV, then the side effects are not supposed to be as bad, and it comes out of your system within 6 months instead of 10 years, in which if you take it orally, it's in your system that long.
Is this a lifelong thing, though?
Yes.
This is something you'll live with for the rest of your life?
Oh, some of the medications we're on anti-cancer drugs, we're on immunosuppressants,
anti-rejection drugs.
Which I'm on now, and we've had some serious side effects, like my liver counts. I've had to come off of a lot of medications because of what it's doing to my liver.
Yeah, so they're pretty potent drugs. My bone marrow was pretty low. They thought, I might have to have a bone marrow transplant at one point in time because of the side effects of the drugs. So, the drugs that we're on is quite toxic to our system, but we have to take them to try and mask some of the inflammation that's going on in the body.
So half the time you don't know if it's the disease or the drugs. Which do you do, Which is better?
That's one of those challenges that you face in trying to figure out what to stay on and what to stay off.
Yeah, but then we've also tried okay, well, I'm not going to take any of the meds at all, but then I tried that route. Not a good route to take either.
Yeah. The pain was just too excruciating.
Yeah.
We do have to take a break. Please stay with us. We're back with more after this. If you have a story idea or would like to contact us, you can email us at hotl@discoveryhealth.ca, or you can send us a letter at 65 Heward Avenue, Toronto, Ontario, M4M 2T5. Welcome back to Health on the Line. The show today, Rare Disorders. We're all back now to talk about the challenge of getting a support system and how the internet has been a lifeline for so many people. And it really was the internet that connected you guys together and helped you get a support group going.
Yes.
Yes.
Actually, once I got my computer, I went online because I was told that I was probably the only Canadian with this disease. So I thought, well, I can't be the only Canadian. I can't be all by myself. So I posted a message on one of the international websites looking for any possible Canadian. And Tracy happened to answer. And she said she was from Ontario. And I was thinking, oh my goodness, there's somebody from Ontario, not just Canada, but from Ontario. And then she answered back and she said that she was not only from Ontario, but she was from the Kitchener-Waterloo area. And I went, no way, because I'm from that area. And as it turned out, we actually live in the same town and we're actually 10 minutes away from each other. So the possibility of that happening is so probably as rare as the disease itself.
What does that mean for you to have somebody else who knows what you're going through? Because no one really gets it except for each other, right?
No, it was absolutely amazing. And when we talked on the phone, it was, she could finish my sentences and I could finish hers, and I could tell her what was going on and she would completely understand. It was just absolutely, I was dumbfounded because there was somebody who really knew. You know, I could tell my husband and he would just look at me like, yeah, okay, whatever, you know, but she really knew.
And that's one of the challenges, right, when you're dealing with a rare disease or a rare disorder, is other people just don't get it. And for you guys, because you don't look as though you have this horribly painful illness, it must be a challenge.
Yeah, when people look at us, they see a healthy individual. What they don't see is what the pain and agony and the fatigue and everything that we have to go through on a daily basis, and just the struggle of us trying to get out of bed each day and the challenges that we have to face. So in a way, looking this way is helpful because we can hide a lot of things from a lot of people, the outside world. But in a way, it's also detrimental because when doctors or somebody else sees us, they look at us and say, well, you're not sick. You can't be sick.
And one of the other challenges is you don't get the money for research because there's so few of you.
That's
we
right.
have to do it to say goodbye. Thank you all so much. Thanks for watching. See you next time.